Hello everyone, brain surgery. When you hear this word, I'm sure a lot of things come to your mind. Of course, there are thousands of different types of brain surgeries for different brain related problems. And when a patient requires brain surgery, either the patient or the relatives do a lot of research. Of course, in case of non-emergencies, not in case of emergencies, as to which is the best hospital, who is the best neurosurgeon, which hospital has a lot of equipments. अरे भाई तुम ये सब छोड़ो, ये बताओ कि खर्चा कितना आएगा? How much does it cost? Yes, it is the cost. The cost becomes the single most deciding factor, deciding where the patient will have his brain surgery done. And in this video, let's look at this aspect. That is, let us try to understand the approximate cost of brain surgery in different hospital settings of India. Obviously, when there are so many different types of brain surgeries done for so many different brain problems, it is never possible to fix one particular value. But say, let's look at one of the commonly performed operation for a brain tumor like say a meningioma. But here too, the cost will vary depending on the location of meningioma in the brain and so many other factors like the hospital course of the patient. Well, in a central institute like All India Institute of Medical Science, that is AIIMS New Delhi, this cost for a non-scheme patient in a general ward is roughly about 30 to 40,000. Of course, it is free of cost for a scheme patient, that is Ayushman Bharat beneficiary. And this cost may increase by say 10 to 20,000 depending on usage of few of the consumables which are not supplied by the government. And of course, this is going to be more if the patient opts for a private ward. While this range is almost the same for rest of the peripheral AIIMS or other central institutes like PGI Chandigarh. All that is okay, but people don't have access to these central institutes. Uske upar se lamba waiting. You tell me about the state. The cost is highly variable for a lot of state-run government colleges. Obviously, it will depend on the state. But roughly it is of the range between 15 to 40,000 for these kind of operations in a general ward for a non-scheme patient. Of course, it's going to be free for a Ayushman Bharat beneficiary, or there can be different types of concessions depending on the different schemes which are in place in different states. In a private medical college, the cost may vary between say 70,000 to 1.5 lakhs for a non-scheme patient, while it may not be completely free for a scheme patient. That is, if the patient is a Ayushman Bharat beneficiary, there may be a capped value, maybe 30 to 40,000 for that particular operation. But of course, it's going to be slightly more expensive compared to a government setup. Here, the cost may increase depending on the course of the patient. That is, if the hospital stay of the patient gets prolonged for whatever the reason, the cost may go up, unlike in case of a government setup where it is usually the same. Well, of course, it's going to be much more expensive in a corporate hospital. I guess this you tell, why is it costly? Why can't they do it for free? Why is it costly in corporate? They should also do it for free. Yes, of course, it's going to be expensive because in simple way, what I can say is there is nothing called free meal. I mean, in a government hospital, if you're getting it for free or at a concessional rate, that is because somebody else is paying for it. That is, in case of a government hospital, the government is paying for it. By government, I mean the taxpayers are paying for it. And in a medical college, it is the students who are paying for it in the form of their fee. But there is nobody to pay that in a corporate hospital. So in the corporate hospital, the patients will have to pay the entire amount. I mean, in case if you are interested, I can make a detailed video on these things. I mean, as to why the prices are so different in different hospital settings, what are the different types of hospitals, what are specialty hospitals, what are multi-specialty hospitals, and all these things. Coming to the corporate hospital, brain tumor operation like a meningioma in a metro city like Delhi, Mumbai or Bangalore may cost somewhere around 3 to 5 lakhs for a general ward patient in a case which goes without any significant complications. That is, in case if there is any complication which leads to extension of ICU stay by about 2 to 3 days, the cost will obviously add up. or say if the patient has infection and he needs high-end antibiotics, then again that will add to the cost. Or say the patient is on ventilator for a few more days, will also add to the cost. Coming to the non-metro cities, in a corporate hospital, this operation may cost somewhere between 2 to 4 lakhs, while all the other conditions remaining the same. That is, all the other variables still remain the same. And of course, the cost is going to be much more if the patient opts a private ward. So this was in brief about the cost of one of the commonly performed brain operation in different hospital settings in India. I mean, it's like, in simple words, I can say that you get this rice, which is an essential thing for every person. The rice is available for less than 10 rupees per kg in a government shop, or it can be as costly as more than 200 rupees per kg, or probably even higher. So you have both the options. It is up to you to choose what you want. So, and obviously rice is as essential as health. So there's no point blaming the corporate hospitals, because everything comes with its own pros and cons. So these are a few points. I hope you found this video informative. If so, give it a thumbs up, share it with your friends and family. And for more such informative videos, subscribe to this channel. Thank you.